underline my questions.
Hi, everyone. Usually I see some of you there. Tom, can you hear me? Okay, great. That's helpful. Thank you. Thanks, everyone, for joining the press conference today. We have a number of announcements about the spike in cases. So the city's cases over the COVID crisis are now up to 3,347. And there's a couple of things that are important to note about the spike in cases that we're seeing around the state and have also been seeing in New Haven. The one main thing that has concerned us is that our data, we feel, has not been fully reflecting the increase that we're seeing. And there's two components that we believe indicate we actually have more cases than we had recently thought. One is that Yale University cases were not included in the data. And the reason for that is a lot of the students have out-of-state addresses. And so the reporting through, I believe, the Yale New Haven Hospital to the state would then not be included in New Haven's addresses because the students had out-of-town addresses. And then the second is that Docs Urgent Care, which is a testing facility, they have facilities in East Haven, West Haven, Hampton, and North Haven, and have been doing a significant amount of testing in the region, have not adequately been reporting that data to the state. As of today, we have a 13.9 case rate per 100,000. That's our 14-day average according to the state. That includes the Yale data. So the state was reporting 12.9, but when you add the Yale data in it, it's 13.9. It does not include the Docs Urgent Care data. And so that puts us in the orange zone based on the governor's classification of the cases. Other indicators of a continuing trend are the sewage data that has been shared in the media already, that typically is around a 5 to 7 day advance notice of the type of increases that we will see. And there was a major spike in that data on Tuesday. So we believe that even though our numbers right now are 13.9, with the caveat that they're not complete because of Docs Urgent Care, that we are headed towards a higher spike and headed towards the red. Before I go on, Director Bond, do you have any other kind of high-level health information to add to just set the stage here, or did I capture everything?
I have a couple of additional things I would like to add. So in addition to the report that the mayor just provided, we are also doing a couple of cluster investigations. And so I know that there were some media inquiries regarding for students, and so I thought this would be a great platform to just address it at the same time. So the health department is conducting an investigation at the First Student Bus Company and are currently doing contact tracing efforts. However, we currently have confirmed that we have 7 positive cases and 3 pending results. Majority were bus drivers and bus monitor. We are contacting their contacts to ensure that we quarantine those individuals. Others have been asked to go into isolation. We have also requested a number of supporting documents from First Student to continue this investigation. In addition, we have asked that they conduct a thorough disinfecting between the building and the different buses. For nursing homes, we are also conducting some investigation, and specifically with Regal Care. There were several kitchen staff that were asymptomatic that tested positive. There was an assessment conducted, and so we have met with Regal Care regarding some of their health and safety protocols, including a resident that's just currently positive as well. And so we are working closely with Department of Public Health, as well as with Regal Care administrators to address some of the concerns that we're having with that facility. And just in closing, we're also investigating a couple of clusters at a local daycare, and we will have an update once we conclude that investigation.
And Director Bond, correct me if I'm wrong, but at least the first student cases were related to a social gathering of those individuals, correct?
Correct. So upon preliminary findings, we have been able to identify that the source of the issue was due to a social gathering, local party, and actually the preliminary report for the daycare is also due to social gathering. And so we are certainly concerned about the increase of social gathering that is happening in the city, and are asking our community to really be mindful of reducing the risk of exposure by gathering with individuals that are not part of your immediate household.
Thank you. So due to the increase in cases and the likelihood that they will continue to increase, there's a number of things that our team has decided to do. And clearly we don't take any of these decisions lightly. We realize that these decisions impact people's lives in significant ways. And so there was a lot of deliberation. But because we're prioritizing the health and safety of everyone, we've decided to move forward with these decisions. The primary one that a lot of folks have already heard about is that we've decided jointly, the health director and Dr. Tracy and I, to extend the remote learning that New Haven Public School students are currently doing indefinitely. As a parent, I know just how hard it is to manage the online learning because my wife and I have a 5-year-old that's doing the online learning program. And there are many care providers that are even in much, much more difficult situations than us, that we're looking very much forward to the opening of schools. But our team felt very strongly that because of the potential health impacts and the data behind the increase in cases, that we should follow what we have been saying all along, that when cases are very low, that we can go back to school, but when cases go up, that we need to make sure that we dial back and go back to that remote learning. So we were, as folks know, anticipating we would go to a hybrid program on November 9th. We are no longer going to do that. We're going to extend the current program of remote learning indefinitely. The second thing that we'll be doing is moving from phase 3 of the government's executive orders to phase 2. And I'm going to have Dr. Tracy and then Mike Pinto in a moment just talk about what that means, or Mike Piscatelli, I'm sorry, talk about what these different aspects mean. The primary thing with going from phase 3 to phase 2 is tightening up occupancy caps in a lot of the businesses. We also will be closing learning hubs indefinitely starting on Monday. Folks that do not know, so the cities stood up 3 learning hubs several weeks ago to facilitate online learning for families that may have to work or may not have the appropriate care at home. And we did that while cases were relatively low to help support those families. Now the cases are going up, and that's a group of young people that are congregating together. We feel that it is not appropriate to continue operating those, and so we will be closing those as of Monday. We are also going to be closing City Hall offices to the public as of Wednesday. And that's an important detail. So next Wednesday, we will be closing City Hall offices to the public. People can, by appointment, access different city resources. but we won't be allowing the general public to just come into City Hall. The reason that that day is important is that we want, and it's very important for the media to know this, we want the press to understand that on Tuesday, people can come to City Hall for Election Day registration. The City Hall offices on the first floor will be closed on Tuesday to facilitate social distancing for Election Day registration, but residents can come into City Hall if they need to register for Election Day registration on Tuesday. So I'm going to hand it over to Dr. Tracy to say a few words about schools, and then Mike Biscatelli after that to talk about going from phase 3 to phase 2.
So good afternoon, everyone. Everyone knows that I have been a great proponent of opening school for our youngsters in the hybrid model. And I was looking with great anticipation for opening on November 9th. I know the pain my families are feeling. My students were very excited to get back into their schools, to be among their peers for learning to take place in that model. I also will say that my staff, principals, and teachers have worked extremely hard to provide a robust learning environment with the remote model. However, many of us were still anticipating the hybrid model on November 9th. Having said that, with great contemplation, the mayor will tell you, with great contemplation and a lot of pushing back and arguing, we came to the conclusion that it is very important to err on the side of caution, to be extremely cautious because lives matter to us. Health and safety of our young people and our families takes the highest priority at this time. And I know there may be families who are very concerned. I've gotten several emails since then. Are very concerned, but at the same time, we have to do what is in the best interest as we see it right now. So working closely in collaboration with the mayor, Director Bond, and as they share the data and what is happening, the decision was made jointly to delay school and the hybrid model until further notice. It is important that my families who are listening know that we take this very seriously and we do understand the pain and the sacrifices that they have been making, not only to be teachers, but also with babysitting challenges and all those things. So as soon as we're able to open back, we'll be the first to open back. Now I have a lot of concerns that people are bringing to my attention. Other school systems are open, even though they're red or they're orange. Why is New Haven doing that? I must say from the get-go, we have always said that we will allow the science to guide what we do. And that's exactly what we're following. So I know there's a lot of disappointment that is out there on every side, but I think it's the right decision.
Thank you, Dr. Tracy. You have been a very, very strong advocate over a very difficult time for making sure kids have access to education. And I know you and I are very much on the same page about opening schools when cases are low. So it's a difficult decision for everyone. Mike, can you talk a little bit about moving from phase 3 to phase 2 and what that means? Remind folks about some of the details there.
And thanks everyone for the time. Obviously a very difficult and very important decision. And first want to say thank you and acknowledge all of the very important work that's been done in our business community to follow the reopen rules and really set a model and example statewide. I think a key part of today's conversation is this is a pattern, around the region and around the nation. And in terms of the phase 2 and phase 3, there was always sort of the planning that it wouldn't be always linear to a complete reopen in phase 4. But to have the flexibility and the resiliency should we have to go from 3 to 2. And in this particular case, the most important sectors for New Haven are restaurants, which were at 75% of indoor capacity. Those will fall back to 50%, as well as the high touch personal services businesses. Again, that were at 75% this week, they'll fall back to 50%. And then indoor performing arts centers, which had been closed up until October 8th, they'll go back to being closed. We don't have as much activity in indoor performing arts. We've seen more outdoor of late. And then just generally, since there's so much focus and support that we're all trying to provide to the restaurants and front-facing businesses in the community, a lot of our attention will now focus on, the 3 different strategies to support our restaurants right through the fall and winter. That being outdoor dining, to which we've extended the permits and the guidance so people can stay outdoors right through the winter and into March, as well as a more renewed focus on the marketing, particularly the marketing around takeout and delivery services. We had a very important call with the restaurant community earlier today to look at cohesive marketing strategies, similar to what Market New Haven is doing in the downtown with the Passport to Dining program that'll run right through the holidays. And then finally, to support any best practice for the more limited aspects of indoor dining right through until we can go back to phase 3.
Thanks, Mike. Before I open up the question, I just want to finish with a couple of remarks about why some of the data indicates that we're in this circumstance, especially given that we're headed towards a Halloween weekend and the holiday season. It is quite clear that most of the cases we are seeing are driven by adults making sloppy decisions. And adults in particular gathering in small groups where they put each other at risk and then put the larger community at risk because of that. And I just can't stress how important it is for people to be smart, be mature, and to keep to their core family group. The first student outbreak, a number of the instances with teachers, we had a circumstance with our Parks and Public Works Department employees. All of these examples were adults socializing together and not taking proper precautions. And that impacts the entire community. And I'm sure that there is just countless examples of that that are driving cases all over. It is so important that we as a community make the right decisions so that we can lower our cases and make sure that our kids are going back to school, so that we can provide our restaurants with an opportunity to make $1 and to hire more people. If we don't take that responsibility as adults, we will be living in a very difficult environment for months and months and months. So with that, I'll open it up to questions. Go ahead, Tom.
Thank you, Mayor, and thank you, everyone. I'm sorry if I missed this, but will the roughly 125 students with disabilities still be going to in-person school, or would they also be going back to online only?
Currently, we are leaving things as normal. The only delay we're having is in the November 9th opening.
That means that small group will still be going to in-person?
That's the plan.
Thank you. And Mayor, you mentioned the closing of the city's learning hubs. Will you also, is the city also encouraging churches and other privately run learning hubs to close, or are you issuing any guidance there?
Correct. We are advising other learning hubs to close. And I think it's a little bit, just to be clear about why this is, because I think it may, to some people, feel confusing. The cases have been low for quite some time. We had camps over the summer for Parks Department because the cases were low and there was the opportunity to be outside. The learning hubs were open because cases were low, and the science said that schools should be open as well during that time. But now the cases are going up. We need to make sure that we're closing up those spaces where there's multiple people interacting that could give each other the virus.
If I may ask one more question before yielding the floor about Election Day. So you said Election Day registration will still be open to the public at City Hall. Are you concerned about Election Day endangering poll workers who will be gathered in person in the same place for a long period of time, or about Election Day being a spreader event in any other capacity?
We're very concerned about any opportunity for people to interact. There's been a lot of different precautions that have put in place to ensure the safety of the poll workers and the individuals that will be queuing up. Becky, do you want to add any details there?
Sure. The registrars of voters have been working very diligently and are currently working very diligently to ensure that all protective measures are in place to protect both the election workers and the individuals coming out to participate in Election Day. All of the polls will be marked with social distancing markers. All of the pens for use for Election Day are single-use pens. The surfaces will be cleaned frequently, doors will be propped open, so there will be minimal touch points. We were joined by the health and inspections team earlier this week, walking through, just making sure that anything that could be put in place to protect the poll workers and voters were addressed. They recommended some additional signage, which will be deployed, again, reinforcing in Spanish and English the need to social distance, wear your mask. There are a number of volunteers that will be out for as you approach polls if you do not have your mask, to hand out masks, and poll workers will be reminding of the importance of mask wearing as well.
Other questions? Looks like Ben.
Just for Mayor Elicker or Health Director Bond, just what would you say to folks who will feel some anxiety or fear hearing about what's the steps the city are taking and what's going on here?
I could start, and then Director Bond, you should add things. I think that you know, in some ways, I keep hearing this feels like March all over again, right? And I can understand that sentiment, but we have learned so much more about the virus that while I do think that a certain level of, I'm not sure if I would say fear, but awareness and caution is important for people to feel. We can't let fear dictate our choices. We need to let science and logic dictate our choices. And that's what we are doing. Our leadership team here is doing to ensure that we're making all the appropriate choices to care for everyone in the city. And it's also, we cannot possibly be successful if our residents don't do the same thing. And by and large, our residents have been really good. But we need everyone to be on the same page about their roles and responsibilities here. Director Bond, do you have anything to add?
Yeah, and I think in addition to that, it's important that, you know, we don't impose a fear, but we certainly want to impose an urgency to remind individuals to wear a mask and physically distance and avoid gatherings, and, you know, both in private spaces, especially indoors in large groups. It's most of our community transmission is frequently occurring, as I mentioned earlier, because of smaller gatherings with family and friends when masking and social distancing recommendations are not being followed. And so I just want to encourage the community that it's a social responsibility. We all play a part in really getting in boxing in this pandemic. And so we want to ask the community to just be mindful and be vigilant about the precautions.
Mayor, I can add something, if I might.
Sure.
The initial question is about the fear and anxiety piece, and I think it's very clear that the pandemic has taken a cumulative emotional toll on folks. We have, since the beginning of the pandemic, worked with our partners to try to help make such supports available. I'll give you one example: is Clifford Beers Clinic has a helpline, and I'll read the number for that helpline if you want to include it in your print. It's 1-844-TALK-4CT, the number 4CT. So 1-844-TALK-4CT.
Thanks, Dr. DeLo. Ben, do you have any other questions? Okay. Anyone else? Go ahead, Tom. Looks like Mike Pinto has a comment or question at some point too. Is that right, Mike? We'll go to Tom and then we'll go back to you because you're on mute, Mike.
Oh, and actually, since I just saw Kyle raise your hand too, since I've already gone for a little bit, maybe I'll defer to
Go for
Kyle
it.
and then I go back.
I'm sorry, Kyle.
No problem. Thanks, Tom. I do have a couple of questions. I know that you, Mr. Mayor, did very well to kind of outline how we got to this place. I'm wondering, do you or Director Bond have any updated data on sort of the trend that we've seen for confirmed cases over the last few days now that we know that there were some numbers that were missing? I know you 13.9 per 100,000, but has our average daily positivity rate changed at all?
Director Bond.
Our daily positivity rate has certainly increased over the last 3 weeks and even 4 weeks. And so in comparison, we have been able to see the trajectory increasing even with the data gaps. I think what's most alarming for us is that we have a data gap. So though we are seeing that the rate is 12.9 as the daily rate currently per 100,000, there's a high possibility that we are going from the orange category, which is the framework that is reported as the indicator, to potentially red. And so we will have as soon as we have an update on our data, which we're seeing to be rectified as of next week, we will certainly provide updates to the community to ensure that we are reporting the daily cases as we get them.
Okay, so you guys have, as you mentioned, you have some indicators that were headed towards the red zone for the other data that you just outlined, and you'll have an updated confirmed number soon.
Correct. And in addition to that, we also assessed the sludge report, which was complementary to the rates that were just reported.
Okay.
Yeah, I mean, just to be clear, so we're at 13.9 with the Yale data.
Correct.
And Doc's Urgent Care has 4 facilities and they're testing hundreds of people each day. We presume that a lot of those people live in the region around New Haven, and a lot of New Haven residents get tested there as well. If we're looking at, in general, the positivity rate in the region, around 2 to 3 to 4%, you would presume that our 13.9 is already putting us in the red.
Okay. And about how long do you think that gap was there from Doc's Urgent Care?
It's been an ongoing issue, and the Department of Public Health has been working with Doc's Urgent Care and rectifying it.
Are they the only facility urgent care wise that has been lacking?
Currently, that's what we've been reported.
Okay. And then
I would just take a caveat that to our knowledge in New Haven, I mean, there may be other facilities in the state.
okay.
We don't, yeah.
Okay. And then my last question for you is, I know you just mentioned the rollback to phase 2. When does that begin?
Immediately, we need to finalize some things with our corporation counsel to make absolutely sure that it's immediately and not tomorrow. But effectively today or tomorrow.
Okay. Okay. That's it for me for right now. Thanks, guys.
Thank you.
Can I go, Tom, to Sabina first and then come back to you? Thanks.
Thank you. This question's for Director Bond. What's the protocol for first student to alert the district or the city that they were beginning to have those positive cases? And was that protocol followed?
So when they have an issue to that level, they certainly are supposed to report it to local health or the Department of Public Health. And so that protocol was not followed.
Okay, and that's part of the investigation?
Correct.
And what kind of penalties or consequences could they face for failing to do so?
We are convening with them and in conjunction with the Department of Public Health, and we will report our final reporting once we finalize the investigation.
Okay, and just finally, do we know if they were transporting students with drivers or bus monitors who had tested positive?
Preliminary, we did discover there's one child so far that did come into contact, and that child has been asked, we have asked the parent to put the child on quarantine.
Okay, and that driver that the child was in contact with, does it appear that first student was aware that that driver had tested positive prior to the contact?
Not prior to the contact.
Thank you.
Thanks, Sabina.
Sorry, one other follow-up question to that then. So the students that were being transported then, they would be the children that were in special needs or English as a second language that were going back to the schools?
I don't think we should get into specific details on the students, but there are multiple different schools that are transported through the New Haven Public Schools program for transportation. Dr. Tracy, correct me if I'm wrong, but it includes Catholic schools and other charter schools and such as well.
Correct.
So it's not just the special needs students. I think we'd be concerned about identifying a particular student at a school.
Okay. And then I'm sorry guys, one last question. I'm just getting a text from Solange.
No
She's asking you, Mr. Mayor, if you could give a few words in Spanish for Telemundo.
Can she contact me offline? Gage can set something up.
Sure, I'll let her know.
Awesome, thanks. Go ahead, Tom.
Thank you. How do today's announcements affect the school meal distribution plan, either at schools or having school buses drive to different locations to drop off?
This is probably why Mr. Pinto was raising his hand multiple times. But go ahead, Mike.
Yeah, I'll take this since this was the piece that I was going to add. Yeah, so tomorrow we will not have the additional bus distribution. We have been using first student buses. So those eight buses in 16 locations will not be operational tomorrow. However, we will continue to have the school-based distribution at 39 schools that we have had since the start of school on September 3rd. Gage has a list of where all of the locations that will be operational tomorrow. We are planning. We are certainly hopeful that we'll have gotten to the bottom and finished the contact tracing and the investigation with the health department, that we can restart busing and meals distribution via bus on Monday.
Thank you for that. And Mr. Pinto, will any work continue at the school buildings in terms of putting in new air filtration systems or new signage, or any of the work that you all have been doing over the past weeks and months to prepare for in-person learning? Are people still going to be in schools kind of prepping for a return to in-person?
We will absolutely still be in the schools. Our custodians and obviously security, just to keep the buildings safe and secure, but facilities and custodians will be in the schools. We want to make sure that as soon as the infection rates go down and that the case numbers go down, that our buildings are in tip-top shape and we're ready to go. I thought they had actually delayed it a little bit for some of the MERV 13s, but they are actually out on doing installation, up on the roofs this morning, even despite the rain. So we are finalizing those last, putting those last finishing touches. And we will continue to make improvements on the buildings while we're closed. We will not, our team will continue to make improvements at the buildings as we go forward to make sure that we are ready as soon as someone gives us the green light, that the case numbers are down and safe, down to safe levels again. We will have our buildings ready to go.
Thank you. And I understand that 13.9 per 100,000 is a low estimate right now, given dog search and care. But either Director Bond or Mayor Elicker, could you remind me and us of what you think a safe level is for, is it under 10 per 100,000 that the city will begin considering going, having school start in person again, or is it under 5, or what looks like a safe number to you all?
Director Bond.
Yeah, so the current framework that we look at is the yellow category is less than 10 cases per 100,000, The category that we are currently in is in the orange, leading towards the red, which is 10 to 14 cases per 100,000, and then over 15,000. So we want to be at the yellow category.
And
Along
Tom,
with, sorry, I forgot to
problem.
indicate, along with ensuring that the hospitalization indicators are also going down. Currently, the hospitalization rates have tripled.
Just to add to that, it's not just that we believe our cases are close to or within the red zone. It's not just that fact, but it is quite clear that we are on an upward trend. And we didn't want to wait to till we were much closer to November 9th to share this information with the public and with families. People need predictability. People need to prepare for continuing to keep their children in a remote learning environment. And given that the trend is upward, we felt like it was very important for us to make this announcement now.
Thank you. Oh, I see Dr. Tracy.
And then another thing that we need to add to this is that even though we've been on remote, we have staff coming in using the internet systems in the school, and we've seen an uptick with positive cases. So I needed to say that too. So it's not just that, this data that we have, but that's an additional piece of data that we've been looking at.
Among teachers teaching from school?
Among staff. I would not say what category, just among staff.
Mm-hmm.
But
do you have any other numbers that you can?
Just to be clear on that point, and Director Bond or Dr. Tracy, correct me if I'm wrong, there's been no identified transmission within the schools. It is people that have gotten COVID outside of the schools that have come into the schools. This information was shared by Dr. Vasquez on the Board of Education meeting on Monday as well, including the numbers.
Correct.
And then, Mr. Piscatelli, could you speak a bit more to restaurants that I understand we're going back to phase 2 and the 50% indoor capacity, but I imagine a lot of people who were comfortable going to restaurants a week ago will not be comfortable going now and for the next couple of weeks. What can you say to local restaurants who are concerned that a marketing plan and even outdoor dining just won't be enough to help them survive the winter, especially with no federal support on the way anytime soon?
Well, I think first and foremost, many people in our business community firmly recognize that everyone needs to do their part and the public health takes priority over any individual need. The support services and efforts that we're making in terms of marketing, outdoor dining, the takeout service will go to a point. Obviously, the strain on every individual business is significant right now. But in terms of that point of priority around public health, it's also modeling the behavior through enforcement. So we've had our enforcement team out regularly right through the summer and into the fall. They'll be out again this weekend. What we'll be doing between now and then is doing all of the coaching, reinforcing, anything we could do to support, even at 50%. So if you heard the pattern of the call today, what might be happening in the business community like we're seeing in private small family gatherings? The tables get closer together. A few more people push up to the bar when no one can be at the bar. All of those little things that may have been happening are things that we need to reinforce and enforce on to make sure that we go back to phase 3.
And then if I may ask one more question of the mayor and of Dr. Tracy. I know both of you were, before the fall semester started, supported having some kind of in-person option. But ultimately, the Board of Ed voted not to. Do you think that New Haven missed an opportunity in the past 2 months to have some kind of in-person education, given that there's a lot of expectation that there'd be a spike come late fall and winter, and we're now not going to have in-person school for the foreseeable future?
So I strongly believe that we missed, and I've always been saying that, we missed a great opportunity for families to come in. But at the same time, on the other hand, I also understand the concerns about whether or not the buildings were safe enough in terms of their ventilation system, HVAC system. So I also understand both situations. But we did miss a great opportunity for our students.
Yeah, I agree with Dr. Tracy.
All right, just
Any other
one more
questions?
question.
Ben, go for it.
With returning to phase 2 standards, does that change the allowed size for private gatherings, indoor and outdoors in the city?
Mike?
We'll send you the link. The state has put together a really good chart that identifies the private gathering sizes indoors and outdoors. Rather than just trying to restate it, it'd be better to give you the link.
Yeah, it's actually in the link. Gage just shared it with you. So everything that's under phase 2 category will be followed.
Thanks. So we're going to go to Emily and then Thomas.
Yeah, thank you. So you said that the city is at 13.9 new daily cases per 100,000. Is that right? Under the state's the most recent executive order, towns and cities can only move back to phase 2 if they hit 15. So I guess
Without jumping the gun, wait till 4 o'clock and the press briefing by the governor.
Okay.
Thanks, Emily. Thomas?
Hi, thank you. With these new developments, how is the city going to be advising university leaders in New Haven on how to proceed? And in your mind, should students start to be worried about being sent home as they were in the spring?
I think that ultimately the universities obviously have to follow the phase 2 guidelines. And that include, places like cafeterias, for example, but that we're all making very difficult decisions based on our capacity to promote social distancing. And in particular to Yale University, overall, the university has been quite good at managing the situation well. This has happened pretty quickly, but we will be having conversations with the university about potential changes as we move forward.
Thank you. And then just a quick question about absentee voting. The city clerk has announced this week they're doing curbside absentee voting this weekend. How have you been sort of monitoring the city clerk's ability to handle the unprecedented number of absentee ballots this election cycle?
I'll turn it over to Becky to add, but overall, and as you know, the city clerk is responsible for the absentee ballot operation, and they've been doing quite a good job under difficult circumstances. They, as of a day or two ago, had already sent out over 15,000 absentee ballots and had received back around 7,500. I'm sure that number is up even more now. Our office has been supporting them in any way that they have asked. We've helped facilitate them hiring more people. My own staff that answers the phones here has been taking turns going over to the city clerk's office to help process some of the paperwork. We've helped facilitate them having a hotline for their for people that have concerns around absentee ballots. I don't know if Becky, you have anything to add to that?
So yeah, just that they are almost entirely up to date in the redundant system, which is the state lookup system. So folks can use that function or call the hotline at 946-6400. I was very pleased today in my visit that some of the staff were actually able to do non-ballot related work. They are caught up and current. And while the phones continue to ring, they're able to address people's concerns and to meet them outside to process those same day applications.
Other questions? Just want to add one more note that anyone can get tested in New Haven for free. And they can find information about where to get tested, even if they're asymptomatic, at the city's COVID website. Just Google New Haven and COVID, and you'll find it. Or you can call the health department hotline, which is 203-946-4949. I've gotten tested so many times, I don't know how many anymore. And people should be doing the same on a regular basis. Dr. Tracy has gotten tested, and many other members, I hope all of the members of our team have gotten tested multiple times already. It's helpful to do the right thing. Wear your mask, social distance, don't gather in groups, and get tested. Couldn't be easier for you to do. Thanks, everybody.